What happens when the person who knows exactly what can go wrong in pregnancy gets pregnant? I'm Meg Faure, and today marks the start of a very exciting podcast series. As you may know, if you've been following Sense by Meg Faure for a while, we have followed 4 mums thus far: Cass, Jules, Nina, and Zoe. And today we start to follow a new mum in her journey. She is a mum who could seemingly know it all as a pediatrician. But just like you, she has her days. In this episode, I sit down with Dr. Nellie Balfour. She's a pediatrician who has spent years in neonatal ICUs and who knows the risks inside and out. And she is navigating now her 2nd pregnancy. And in this first episode, we kick off following her real journey in real time, semester by semester. So in this episode, this is what we unpack. So we first of all talk about why medical knowledge doesn't protect you from pregnancy anxiety, and actually, sometimes it makes it worse. Then we talk about prenatal depression, and let me tell you that today I learned something new. We spoke about low mood in second-time moms and why it is so often missed. Then we go on to talk about the truth about medication in pregnancy, obviously related to prenatal depression, and why so much of what you hear and read on social media is actually quite simply wrong. And then we swung it around and Nellie asked me a fascinating question about breech babies. And she was specifically looking about the impact of breech babies on motor development. And it led us into a conversation on the concept of rupture and repair. So what happens when something's going wrong? How do we repair it? Because we know that there is no such thing as a perfect pregnancy or a perfect mother. And the magic, it turns out, happens in the recovery. This is a fabulous episode. I am so excited for this journey with Nellie, and I want you to get involved right from the get-go. So do subscribe to the podcast wherever you listen, so that you'll always be notified of when we have one of our episodes coming up with Nellie. And you can also follow her on Instagram at Dr. Nellie Peds, and she will track her journey along there as well. So do stick around, do stay with us. It's going to be a fabulous episode. Welcome to Sense by Meg Faure, where we make sense of the science and art of parenting. Parenting is grey, gritty, and beautiful all at once. And my life's work as a healthcare professional is helping parents feel more confident in a season that can feel really overwhelming. In each episode, we share honest conversations with real mums, dive into the science with experts, and simply make sense of it all in practical ways. This is your space. You're not alone, you're held. So let's unpack the journey of a lifetime with sense. Welcome to the podcast, Nellie.
Thank you so much, Meg. Thanks for having me. I'm super excited to be here.
It is so wonderful to have you here. As I've just mentioned, you are a pediatrician and a mum to 1.5, because you are halfway through your 2nd pregnancy, which is really, really exciting. And today we're going to be talking a little bit about that 1st trimester. And I thought, when we chatted with each other, that we would look at it both from the lens of being a mum, with all the questions that mums have in the 1st trimester, but also with a little bit of a lens as a pediatrician. So we're going to be going through all of that today. And I'm just really, really excited to start the series with you, Nellie.
Awesome. Let's get into it. I've got a lot to say.
Excellent. So I guess before we get started, I'd love for you to share with everybody your journey to becoming a pediatrician and just who you are. Who are we speaking to today?
So I'm Dr. Nellie Balfour. My full name is Sanelisiwe, but everyone refers to me as Nellie. Even my family, since I was really little. I'm a pediatrician who trained basically at UCT and through Wits. I absolutely loved pediatrics while being an intern and decided to go into it because for me, it's just more rewarding than anything. I know I get asked a lot, like, isn't it just so sad with, the babies and the little ones and when they get sick? But for me, I just think it's way more rewarding and I love it with all my heart. So I qualified as a pediatrician 5 years ago now, and then graduated from med school even longer, I think, 15 years ago. So yeah, I've worked at multiple hospitals around the country, including public and private. But right now I am baking my own baby, and I'm not currently working, and I'll get back into it once I'm done.
That's so exciting. So it must be quite a thing to be a pediatrician with all that insight and to be baking a baby, because you have got the anxiety of knowing just too much, actually.
So, I mean, I think a lot of people say to me, "Oh, it must be easier for you being pregnant, because you know what's wrong and what's not wrong, and you've seen this, and you have all this knowledge and information." I think it might be a bit worse. I think when you know too much, it's just, more anxiety, more fear, more could it be this, could it be that? Plus, I've worked in neonatal ICUs and NICUs for years. So I know exactly what can go wrong and what can't go wrong. And I'm the one who gets called when things do go wrong. So yeah, I think it possibly might be a bit worse.
Yeah, it's so interesting. When my third baby was when I was pregnant with her, I can remember people writing to me and saying, "Oh, Meg, it's going to be so easy for you. You know everything." By that stage, I'd already written 1.5 books. I think I'd almost finished. No, I hadn't quite finished Sleep Sense, but I'd definitely written one book, Baby Sense, and I'd started the Baby Sense company. And they said, "Oh, this is going to be so easy." And I think in some respects, I thought it would be easier because my second baby was very easy. So I thought, oh, this third one's going to be even easier, but she wasn't. And I think the reality of being pregnant and a new mom is very leveling. It doesn't matter if you're a plumber or a pediatrician, everybody goes through a lot of the same journey. And part of that is, of course, the journey of matrescence, which is the emotional journey of becoming a mother, which you actually go through with every baby. It's always this transition. So I think motherhood, I've always said motherhood is the great leveler. It puts us all kind of at base case.
Yeah, we're all together in it, and it humbles you. It does, especially when you think you know everything. Before having kids, it definitely humbles you, but it's a beautiful journey.
Yeah, it certainly does. So, Nellie, when we track a mom's pregnancy and her baby for the first year of life on this podcast, I always have a little bit of a format, and that is the wins, the challenges, and the questions of the moment. So, I'd like you to share with us the wins and the challenges and the questions of the moment from your first trimester of pregnancy. So, yeah, what were the wins that you experienced? What was wonderful about your first trimester?
What was wonderful was everything before 8 weeks of pregnancy. So obviously finding out that we're pregnant, which was great because we wanted to have a baby pretty much around 2 years after we had our first child. So I think that that was great. It was super exciting. We had a lot of life changes. So I think that that was super exciting too to come at that time. And then the 8 week mark hit, and we'll talk about challenges later. But I think another win was finally getting over that massive hump of the nausea and the vomiting and the exhaustion and all of that. Because for me, unfortunately, both of my pregnancies were not easy in terms of symptoms. I've had pretty much every single symptom underneath the sun. So a win for me is when I can finish one meal, and that's happened recently. So that's a massive win because I love food. I'm a huge food lover. Food is like my love language, and going out to dinner is like my social currency and trying out new restaurants and everything. So it's a really sad time for me when I can't eat. So having my first proper complete meal is a huge win. And also just getting the energy to be able to play with and pay attention to my 2 year old. I think that's a massive win because I went through a lot of mom guilt, which I'll speak about as one of the challenges, just from being so exhausted and just down and out and not being able to do anything. So I would say for now, those are my major wins.
And before we get on to the challenges, there's obviously the win of actually falling pregnant, because that is a big thing. Did it happen easily for you both times, or was it a challenge? What was that journey like?
I'm pretty blessed. It happened easily both times. I know that there's a lot of people who go through challenges with being able to conceive nowadays, and I've had many patients who've also gone through it. But I think God blessed us in that each time it was fairly easy, and we had planned for it to happen, and it just happened really easily. So I think that that was something that I'm very blessed with. Yeah, it was quite quick.
That's wonderful. And then another win, of course, is the first moment that you realize you're pregnant. Did you realize you were pregnant before you took a test, or was the test the first indication? Tell us a little bit about that, and then also how you told your husband about it.
That's super exciting. So this is actually really interesting. So both times I knew I was pregnant before I took the test, just because I know my body really, really, really well. And I had weird and wonderful symptoms. But the number one thing that actually gave it away each time is, I don't know if you've heard of Couvade syndrome or Couvade syndrome. So it's basically something, a phenomenon in which your partner displays pregnancy symptoms when you are pregnant. So before I had taken the test both times, my husband displayed symptoms, especially this time. So this time he was nauseous, he was tired, he slept a lot, he didn't have an appetite, his tummy was upset. And then I think that's when he told me that no, 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 the last time I experienced this is when you were pregnant the first time.
Oh my
And
word.
then that's when I took a test and then it was positive. So it happens to like 25 to 60% of partners of women who are pregnant. And I think it's fascinating because the first time I didn't believe him, the first pregnancy, I was like, okay. But then this time it was even before I took the test, and that was awesome. And then I just surprised him with a cute little note and a pregnancy test when he came back from work on the bed, and it just said, second time dad, and he was ecstatic.
That's so precious. That's precious. And once again, before we get on to the challenges, did you find out the gender in the first trimester?
Yes. So because I am advanced maternal age or considered a geriatric pregnancy, I'm over the age of 35. We had to do a non-invasive prenatal test, which basically just sees whether or not your baby has, the normal chromosomes 46XX or 46XY. So because of that, in both pregnancies, we knew by 10 to 12 weeks what the gender of the baby was,
And
which
are you
is
keeping it a
it's really
secret?
special. I'm keeping it a secret. I'm going to tell people soon, but I'm keeping it a secret for now.
Okay, excellent. So if people want to know about that, you're going to have to go and follow Nellie on her Instagram, because that is, I'm sure, where you're going to announce it if you do announce it.
Yes, I am.
Excellent. Well, I mean, just all of that story is just so beautiful. It takes me back to my first pregnancies, the excitement of finding out, the absolute desire to be pregnant. I also fell pregnant 3 times, very, very quickly. And with all of them, I did a little bit of spotting at around about the date that the egg would implant. And on that date, I thought, oh my goodness, I'm losing what I think is a baby. And of course, didn't lose it. And just the incredible excitement of having a secure pregnancy, which not all moms have. But there is that joy and that enormous win that we must recognize. So let's move on to the challenges, because you mentioned right at the beginning that this hasn't been straightforward. So tell us what has been the big challenges, particularly in the first trimester.
So for me, this pregnancy particularly, which was pretty similar to my first pregnancy, the intense food aversions. So just, not wanting to eat anything, smells of things just being too much for me, making me nauseous. Luckily for this pregnancy, I didn't vomit compared to my first pregnancy where I did, and I ended up having to be admitted to hospital for excessive vomiting. But in this pregnancy, I was still admitted to hospital for a UTI. So I don't get UTIs unless I'm pregnant, and they can be pretty bad in that they cause what we call uterine irritation. So my uterus literally cramps nonstop, and it feels like a mini labor. So I had to be admitted in this pregnancy for that, as well as last pregnancy. And then they had to give me hydration because I was also dehydrated and not eating properly. So that was a massive challenge. On top of that, I had really bad sciatica, and nerve pain that radiated from my lower back down to my leg every single time I would bend down. So that was terrible too. And then I think for me, just the biggest thing was mom guilt, which I'd mentioned before, because I'm usually very hands-on with my toddler, and we play a lot and we read a lot and we go around a lot and walk a lot, but I just couldn't do that at all for the mere fact that I didn't have any energy, and I needed to sleep all the time. I could sleep for hours and hours on end. But then I think the major red flag for me was prenatal depression. So I know that everyone talks about postpartum or postnatal depression, but we actually call the group of all the depressions surrounding pregnancy peripartum. And it's studied that first-time moms typically get more postpartum depression, and second-time moms typically get prenatal depression. So It's very interesting. And I just think it's because of how your brain changes and the hormones and the emotional changes during pregnancy. So I had a really, really bad prenatal depression to the point where I had to be on medication and all of that stuff because I was not eating. I lost 6 kilos. I was sleeping a lot. My mood was low, all of those types of symptoms. So I'm glad to say that I'm out of that now and things are way, way better. So I can just be more present for my little one as well as my family.
Yeah, well, you've unpacked so many things there. And I think let's kick off with that antenatal depression and anxiety. What was very often when people talk about postpartum depression, the overwhelming feeling is actually anxiety, which I have experienced. I experienced that for my firstborn. It was short-lived, but I mean, I was anxious on a level where I wasn't as functional as I should have been. What is antenatal depression like? Is it more low mood, dysthymic feeling like there isn't a tomorrow, or is it more anxiety, what's coming? I mean, where does it sit, or is it a mix? Today's Dose of Sense is brought to you by ParentSense, the expert-based parenting app that gives you daily support from pregnancy to sleep, feeding, and daily routines. Take the guesswork out of parenting. Download ParentSense today and use the code SENSE50 for 50% off. Is it more low mood, dysthymic feeling like there isn't a tomorrow, or is it more anxiety, what's coming? I mean, where does it sit, or is it a mix?
It's more low mood. So unfortunately, lots of the symptoms of pregnancy actually overlap with the symptoms of antenatal prenatal depression because you'll be asked by psychiatrists, are you eating? No. I mean, first trimester, many people don't. Are you losing weight? Yes, a lot of people do. Are you sleeping properly? No, a lot of people don't sleep well, also in the first trimester. There's just a lot of different things, but the main thing, or the main symptom rather, of the antenatal and prenatal depression is a low mood or dysthymia, feelings of hopelessness, wanting to sleep all the time, feeling like you can't make it through to the next day. So it's actually more common than we think it is. And because I went through it and I read up a lot about it's quite interesting that a lot of women go through it. And there's actually been a few women who've taken their own lives because of antenatal or prenatal depression.
It's very interesting. And, I think you mentioned it, but people don't talk about it. And, I think it's one of the terrible aspects of both antenatal and postpartum depression and anxiety is that there's a stigma, and that stigma is associated with the fact that what's wrong with you? You should be blessed. You're having a baby, like what, be thankful. And a friend of mine who's actually a psychotherapist, amazing woman, and she wrote a book that actually wrote the forward for, called When Blessings Don't Count. And one of the reasons that I wrote the forward was because that title stood out for me, that actually, yes, when everyone says count your blessings, but there are moments in your journey where the basic blessings don't count. You just don't want to be there.
Yeah, and I think that's what was difficult for me because it was such a blessing to be able to fall pregnant and, for us to go down this journey again that we wanted to be on, but then to be faced with this challenge, this mental health challenge. And I did get quite a few people say to me, but you have so much to be grateful for. You have another baby on the way. You guys just moved to a new place and all of that stuff. But it's just so difficult to get your mind out of there because, it's an actual mental health condition. It's a psychiatric condition. It's not just something that you're going through.
Let's talk about this a little bit deeper. If a woman is going through this, so she's feeling like she doesn't want this pregnancy. She's feeling exhausted. She's feeling the guilt around her toddler. The world feels overwhelming. What would your recommendation be to her? What did you do or what did you not do that you have learned from that you think other women can learn from?
Because I'm a healthcare professional, I tend to try and self-treat and self-diagnose. So luckily at that time, I mentioned this to my gynae and she referred me to a psychiatrist. And then everything seemed to get better once we're on medication. So I would just say to talk about it firstly, to tell someone how you feel, because I think any feeling of hopelessness during a time which is supposed to be joyful should be a red flag. It means that there's definitely something wrong. I know a lot of gynaes are super helpful in directing you to the appropriate channels if you feel that way. And then obviously sometimes your gynae can start medication. Sometimes you may need to see a psychiatrist. Sometimes GPs can start medication. But just to talk about it and mention it to someone and then hopefully get some help, because even therapy helps. Speaking about it helps a lot. Yeah. So that's what I would advise people to do.
Yeah, absolutely. And, I mean, I attended a lecture at Red Cross just a couple of weeks ago around medication and pregnancy. And I think there's also a lot of nonsense, and particularly for moms who are tapping into social media accounts and lightly researched kind of maybe it's not even researched, it's just fake news. There's a lot of wrong information, erroneous information around taking medication in pregnancy, but actually it is safe and actually better for the mom and the baby to be on the right type of medication in pregnancy.
Absolutely. I mean, I know I get asked very, very often by a lot of my followers or my patients, can I take this while breastfeeding? Can I take this while pregnant? Like there's a lot of those questions, particularly with breastfeeding too. But there's so many medications that are safe to take. And unfortunately, there is wrong information out there. And you and I spoke about it on the last podcast about who you can trust on social media when it comes to medical advice, because I think a lot of people are giving advice out there but don't particularly have the qualifications and it can be dangerous. But yeah, I would always say speak to your healthcare provider. They're the ones who are going to tell you, especially your gynae. So if you're pregnant and you're worried about what medication to take, most or every gynae will be able to tell you whether it's safe or not, because I mean, this is their bread and butter. This is what they do all the time.
So do you have any questions that you think are very common for moms in the first trimester?
Yes. So I know the first trimester is filled with anxiety from a lot of moms because everyone wants to get past that 12-week mark, because obviously the survival rate, or rather the chances of your pregnancy progressing, are higher once it's after 12 weeks. So I have questions more about later on, the later trimesters. Do you want specifically for first trimester?
No, you can just go for it. Whatever's coming to mind.
I would like to know about breech babies, because a lot of people don't know the basically like I wouldn't want to say the after effects, but once a breech baby is born, the different things that can affect them as compared to a baby who's born cephalic. And this is not just a natural delivery, but cesarean sections also, because I know that there can be certain effects or things that affect the baby if they're born breech via cesarean section. So as an OT, I would love to know from you.
Yeah, what a fabulous question. I really love it. So a couple of things. Most babies will turn by the third trimester, within the third trimester. And what's quite interesting is that there's a part of the brain called the vestibular system, which is inside the inner ear, that you will know all about because you've probably dissected it in anatomy, but that really tells you which way you are in terms of gravity. So it's a gravitational, and there's little things called otolithic organs which sit inside the gel. And when you are head down, they sink down in the otolithic gel, and then in the gel, and then they will tell your brain, okay, this is downwards. That's the direction of gravity, and that's how you know if you're going up or down. And we believe that that part of the brain, or that part of the vestibular system, is actually affected, and so babies maybe don't know that this is the way that they need to turn down, and that it could be, not conclusively, but it could be an early indication that the vestibular system is not giving all the right messages. So that's the first thing, that, when you think about the vestibular system and the deficits that can come later, which we'll talk about, the question is there a deficit in the vestibular system because the baby didn't have the upside down effects of gravity in utero, or did they not turn upside down because their brain actually wasn't quite working it out? And we don't know which way around it is, which comes first, the chicken or the egg. But there are effects from the vestibular system that are actually quite material later on. So the vestibular system has a direct tract into the spinal cord called the vestibular spinal tract. And that tract gives information to the muscles and the joints of the baby's body to build up muscle tone. And it also gives input around equilibrium reactions or balance reactions, and around protective reactions, and eventually around coordination and bilateral integration. So these are all the things that make up our gross motor. These are the components of our gross motor skills: muscle tone, balance reactions, protective reactions, bilateral integration, and your coordination between obviously your two sides of your body. So when the vestibular system is not getting good messages, there's a mess up there. And so your muscle tone can be affected and your balance reactions. And so we do see that. And so as an OT, when a little one comes in who's got poor balance or isn't coordinating the two sides of their body, we'll often go back as a sensory integration OT and we'll say, well, let's have a look what's going on in that vestibular system. How does that vestibular system actually register movement? And we have a few tests that we can do to have a look at how that vestibular system registers movement. And then what we do as an OT in sensory integration is we actually put the baby or the child onto swings and onto games with a lot of movement within their comfort zone that actually builds up all that information in the vestibular system and feeds it back to the muscles and joints. And that's really how it all begins. So taking it back to pregnancy, the one question would be, if you have a breech baby, does that necessarily mean that that's going to be the trajectory, that they're not going to get the right vestibular information and therefore will have low tone and therefore won't be coordinated? And the answer to that question is no, it's probably not as linear as that. And I certainly wouldn't spend my third trimester of pregnancy worrying about the fact that my baby hasn't turned head down. But it is something that later on, if your baby never turns head down and your baby is always breech and is delivered breech, whether by cesarean section or vaginal delivery, it might be a question that you will be asked by an OT one day, was your baby breech? I don't think that there's any other conclusive impacts of a baby being breeched other than the fact that birthing a breech baby is significantly more difficult if you're going to do it vaginally because their feet are coming first. And most doctors are really reticent to do that, particularly in South Africa. So I think getting a lot of movement, it is one of the things, just to pull it back to what you can do in pregnancy. It is one of the reasons why we want moms to move in pregnancy and why bed rest in the last trimester of pregnancy, which a lot of women have to go into, also obviously has an impact on the vestibular system because your baby's getting less movement. So in a perfect world, and we all know that there is no such thing as perfection in pregnancy, and I'll talk about that a little bit just now, but in a perfect world, you're doing lots of movement in pregnancy. If your baby's not turning into a head down position, there are little exercises you can do that you don't have to manipulate your baby, but you can get into certain positions and you can go and look up about that. But in an ideal world, move a lot, get into the right positions, and hopefully your baby turns. One of the things that I do want to mention here, because it's such an important foundation for everything in parenting, including the maternal guilt, by the way, that you had about the play with your little boy in the first trimester, is that there is supposed to be certain amounts of rupture or damage done along the way with babies. And the beauty of it is that the repair is where the magic happens. And what I mean by that is that we are all going to stuff up and life is not going to be perfect. And that could mean that you've got a breech baby, or that you are on your back for your third trimester, or that you've got a lot of guilt about the stuff you didn't do with your 2-year-old in the first trimester. And the beauty of life is that when you repair that and you go back and you engage with your little one, or you get yourself moving or get your baby moving after they're born, there is so much repair that happens. And that's actually where the magic happens. And I think that's what we've got to remember instead of carrying the guilt or the concern around, for instance, a breech baby.
I love that. That makes me feel better. And women are superheroes. Moms are superheroes. I think we're just amazing. So that's really awesome. Thank you, Meg.
Yeah, and it really is important. I wrote a blog this week around imagine a world, and I hate to tell you, Nellie, I fear that this world will come one day where there is a perfect, absolutely perfect parent. Like they do everything by the textbook. They happen to be an AI robot who might look fabulous, but that AI can be built in with all the perfect responses for parenting. It really can be. And I think the world will come, unfortunately, where this does exist. And so in this scenario, when I was writing this blog, I said, imagine this can be this absolutely perfect parent. What does that mean for babies? And we, of course, know that it's going to be terribly, terribly damaging because babies need gritty mothers. They need moms who fail. They need moms who cry in front of them. They need moms who stuff up along the way and give them a big hug and a cuddle and tell them that it's going to be okay. And that's what really good mothering is about, is the repair mixed up with that, and mixed up with the damage that is being done along the way. And they're small pieces of damage that we all do, or we call them rupture, not damage, but it's small pieces of rupture along the way that we can then repair. Well, you brought such a fabulous question and such a great first episode with you, Nellie. I'm super excited that we're going to be tracking this pregnancy. And the next time we speak to you, we will talk about the second trimester, and you will be further along the way and starting to think about birth. Thank you so much for joining us here today.
Thanks for having me, Meg. This was really, really fun. I love it. And I can't wait for next time. I'll probably have like 100 more things to say. And I'm looking forward to it. Thank you.
That's brilliant, Nellie. And moms, if you're wanting to track Nellie's pregnancy, because now you're super interested, Please do go and follow her. Nellie, what is your Instagram account?
My Instagram handle is at Dr. Nellie Peds, and Nellie is spelled with an IE at the end.
Dr. Nellie Peds. So do go and follow her. Thanks, Nellie. We'll chat next time. Thank you for joining me today. I hope today's conversation brought you a little more clarity, calm, and confidence on your parenting journey. If you enjoyed the episode, please do share it with a friend who needs to hear it today. And also go and subscribe to the podcast so you never miss out on an episode. I'll be back next week with another episode, same time, same place, and always here to support you. And in the meantime, download the Parent Sense app to take the guesswork out of feeding, sleep, weaning, routines, and everything in between.